Bismillahirrahmanirrahim. Assalamu alaikum. A 16-year-old girl comes to the office for evaluation of excessive facial hair. The patient has used multiple creams and makeup over the last year but is still embarrassed by the facial hair. She also had irregular menstrual cycle since mandatory at age 12. Her last menstrual period was 6 weeks ago. She is an avid runner. Blood pressure is 122 by 70 and pulse is 87. BMI is 20 kg. Physical examination show hirsutism. The patient has normal external female genitalia. The rest of the examination is unremarkable. Urine pregnancy test is negative. Laboratory results are as follows: 17 hydroxyprogesterone, which is 350 nanogram per milliliter, which is elevated. Serum testosterone is also elevated, and serum dihydroxyapine sulfate is also elevated. Serum glucose and electrolytes are normal. Which of the following is the most likely diagnosis in this patient? Adrenal carcinoma, Cushing syndrome, germ cell tumor, idiopathic hirsutism, non-classic congenital adrenal hyperplasia, polycystic ovarian syndrome, use of performance enhancing agent. So first of all, this patient is 16-year-old. She came to the office for evaluation of excessive facial hair. She has irregular menstrual cycle. On physical examination, which show hirsutism, patient having normal female external genitalia, and pregnancy test is negative. Her 17 hydroxyprogesterone is elevated, serum testosterone is also elevated, and serum dihydroxyapine sulfate is also elevated. Rest of the examination is normal. Her serum glucose and electrolytes are also normal. So based on these hints, what is the diagnosis of this question? The diagnosis of this question is non-classic adrenal hyperplasia, which is due to 21 hydroxylase deficiency, which is an enzyme. 21 hydroxylase deficiency enzymes. So here the diagnosis of this question is non-classic congenital adrenal hyperplasia, which is due to the 21 hydroxylase deficiency. This patient has non-classic late onset congenital adrenal hyperplasia based on hyperandrogenism and on elevated 17 hydroxyprogesterone level. The majority of non-classic congenital adrenal hyperplasia is due to a partial deficiency in 21 hydroxylase, which result in impaired conversion of 17 hydroxyprogesterone to 11 deoxycortisol. Build-up of 17 hydroxyprogesterone is then diverted toward adrenal androgen synthesis, resulting in hyperandrogenism. Patient having irregular menses, severe acne, and hirsutism. Virilization, which is clitoromegaly, deepening of voice. Since the enzyme deficiency in non-classic congenital adrenal hyperplasia is relatively mild, sufficient glucocorticoid and mineralocorticoid are produced. Come to the incorrect one, adrenal carcinoma. So androgen producing adrenal tumor typically present in adulthood with rapidly progressive hirsutism and virilization. Serum dihydroxyapine is markedly elevated with concentration more than 700 microgram per deciliter. Choice B, Cushing syndrome. Although Cushing syndrome can present with hypertestosterone, which is virilization, but this patient didn't having the symptom of Cushing syndrome, which is hypertension, moon face, buffalo hump, etc. Choice C, germ cell tumor. So ovarian germ cell tumor typically present with abdominal ascites, pelvic mass, and pregnancy symptoms. Choice D, idiopathic hirsutism. So idiopathic hirsutism is the conversion of 17 hydroxyprogesterone to testosterone in the hair follicle. There is usually a positive family history of normal positive family history and normal 17 hydroxyprogesterone and androgen level. Choice F, because polycystic ovarian syndrome can present with menstrual irregularity and hyperandrogenism. However, 17 hydroxyprogesterone is non-elevated. Choice G. So exogenous androgen is use of performance enhancing agent would not cause elevated 17 hydroxyprogesterone. Thank you.